I'm a surgeon basically, so I'm used to dealing with sleeping people. I operate on people who are sleeping, but I've never talked to sleeping people. So I would like to be you guys to be awake. Now, I want you to ask how many of you are really interested in medicine? Lift your hands. How many of you are interested in staying healthy? Wow.
100%.
I wanted to see whether hands are moving up or not. So that's the reason I asked that question. Now, how many of you want to live 100 years? Yeah, that's a sensible. Okay, sir. Now, now a caveat. I'd like to add a caveat for it. How many of you, if you're totally healthy at 100 years, want to live 100 years? No? Okay. Even if you're healthy, you don't want to live so long. Why? Are you not? Are you? Okay. Let me try to get you into what. I mean, everything. I asked this question to a surgeon. He was the head of US American Army. And he was in the front line of Vietnam War. And he was the head of surgery department in the armed forces of US. His name was Richard Satawa. He's still there. So after the war, he went, told the US government that none of our soldiers deserve to die. They have to be treated, if they have to be alive, you have to treat them at the war front, in the battlefield. And they deserve to be treated by the best surgeon in the best university hospital of the US. So how do we do it? So he said, we have to develop technology that can allow the surgeons sitting here with all their equipment. We develop equipment and resources for them to be operating on these people there. So he could sell his idea. He was a great orator also. And after listening to him, a lot of money went into something called DARPA. DARPA is akin to DRDO. DRDO, I think all of you know about it. So after that, there was a huge amount of technology developed in simulation, virtual reality, augmented reality, space medicine, robotics, and all this has really helped technology to go to a great level. In 1999, I conducted a conference here called Breakthrough Surgical Technologies. And in that conference, I happened to invite him, and he was the main speaker. I gave him 6 lectures because the technology, the knowledge that he has is unbelievable. And we asked him a few questions. I asked him, today a baby is born, how long will the baby be able to live with the evolving technologies? If he can afford and he is able to access all the technology. He said, 150 years is what I expect. Then the second question was, in the next 150 years, in whatever technology we develop, will he ever die? And that question remained unanswered. So some people felt that they may even be able to live forever. So we don't know. Science and technology is progressing very fast. So let's see what exactly can be done to maintain your health and for healthcare. So let me just go into a mundane introduction. AI is a study of algorithms that enable machines to reason and perform cognitive functions. So it normally increases our diagnostic abilities. It is going to increase the ability to treat a person and to give a proper care to a patient. So that means there's something that a doctor is doing. So what is he doing every day? He's trying to learn about the new medicines that are coming, new diseases that are being discovered, how to treat them. He's trying to reason out how he can probably diagnose a patient who comes to him with fever. Then he would probably go into solving his problems by doing diagnostic tests, and then he would take a decision on what type of treatment he has to give. So if all these aspects are addressed by artificial intelligence, then definitely it's going to be enhanced healthcare that we'll be offering in the near future. Apart from that, we also have the capabilities of dealing with large databases and complex tasks. To name a few things that are going to happen in the near future, I think we will be looking at diagnosis of diseases much earlier than what happens today. Probably many of you have heard Pichai talking about doing a nice image and then trying to say who will develop a diabetes after 5 years or 10 years. Today we can find out. So we are looking at developing enough AI to find out the things much earlier. We are looking at improving medical images. We are looking at predicting things before they happen. Imagine if we had AI before COVID had come, and if we had actually known at least 3 to 6 months before COVID attacked us, how many lives could have been saved. So we're looking at how to discover drugs very early. Imagine we had discovered some drugs for COVID as soon as it came. Even after 2 years, we were not able to discover anything. We were able to do clinical trials. I'll tell you what trials we did during COVID and how it helped. And then personalized medicine is something that's coming out it's a very new field, and you all need to know about it. EHRs and medical robots are always there, and it's going to improve by the day. So there are a whole lot of things that we will be looking in the future. Early detection of ailments, improving our decision making, helping the treatment that we are offering to our patients, expanding access of medical services, associated care, which is very important today. Rehab has become a very big issue. Giving a superior experience than what we are able to give now. Wearable devices. Are you guys have a wearable device? Yeah. Everybody has a mobile phone, and it is a wearable device. It's checking your heart, it's checking your effort, it's checking how much you're walking every day without even you knowing it. And it's going to do a whole lot of more things in future. And I'll come to end of care. That's another fascinating thing. So let's take one by one. First, let us go to early detection of ailments. So today we have a lot of pattern recognition, or what you call computer vision. So earlier we have a CT scan done. A CT scan takes cut images in your body of 1 centimeter. Every 1 centimeter it takes an image. And that is a huge amount of effort for a doctor to study and then look into. Every centimeter of it he has to study and see what's there, is there any abnormality. Today we are having CT scans that are taking 1 millimeter cuts. And imagine a radiologist trying to read a whole body scan. One patient to study the whole body scan at 1 millimeter, you will be exhausted at the end of the day. So it's not going to happen. It's not just augmenting your effort, it is just going to need automation of your work. And that's going to happen using AI. So MRI images, CT images, a whole lot of things can be read. And we are trying to find out exactly a few small, very detailed stuff, which even the slightest, minutest variation we are able to detect and say this is a pre-cancerous, means tomorrow it's going to become a cancer. So by using these algorithms, we are able to detect and find out who will develop cancer maybe 6 months from today or 1 year from today. And that's going to be something fantastic. We have gastroenterology. Gastroenterology, you have starting from your mouth to the esophagus to the stomach and the 21 feet of small intestines and 4 feet of large intestines. So everything has to be studied. So we have scopes that can go up to 1 meter from this side and that side. Now we have something called an enteroscope, but then those are not really able to pass. So we have made a capsule with a camera. So all that a person has to do is swallow the capsule, and that tomorrow it passes off in the motion. But then what it has done is it's been taking images, photographs all the time inside your intestines. And there are thousands of images that are taken, and then there's got to be an artificial intelligence which tries to read, sees what, is there any abnormality, is there anything, something abnormal that we've looked at. And using that, we are able to disease, find out polyps, different, even small cancers, tumors, ulcers, everything can be detected. Coming to neurology, we have monitoring of patients who are permanent ambulatory monitoring. Somebody has a fit. You've seen so many WhatsApp videos and things like that. Somebody falls at the wrong time and then he falls into a swimming pool and dies, or he has a traffic accident, he was driving and he had a fit. So supposing we have a wearable device and before a fit comes, it can actually look at something that's happening in him, and then it warns him to get to a safe place or pop in a tablet and then stop the fits. And that's what's going to be done with artificial intelligence. And there are a whole lot of things that we diagnose. The minute a patient is coming into my clinic, the way he comes in, the way he walks, the way he sits, and the way he is putting his hands, the type of tremors that he has in his hands, I know this is the type of neurological disease he has. And even when it is very early, very, very subtle, artificial intelligence can actually, using wearable sensors, look at the signals that are coming from these signals, diagnose different types of diseases. So there's always a confusion. Is it multiple sclerosis? Is it Parkinson's disease? Is it just Parkinsonism? Is it Huntington's disease? Well, these very, very subtle things can be made out using artificial intelligence. Now, coming to cancer, we take a small biopsy of a tissue and then we put it under a microscope and then read it. Today, we have endoscopies. As I said, we put in an endoscopy. It's attached to a camera which is not even 4K, 8K and 12K. And then you can actually look at very large images, very, very high resolution images. And then looking at these images, using AI, you can actually see very small changes that are happening in the cells. And then you know this is an early cancer, or this is something that's going to be a cancer. So now there is, for example, now in Japan, they have a lot of esophagus and stomach cancer. That's one of the leading things there. But then they're not behind in technology. So what they do is, there's a rough brush-like thing that's like a tablet that they swallow, which is attached to a thread, and then they just pull it out. So when it's coming out, it is brushing their esophagus. So some cells on the mucosa get stuck to the, and then you put it in water, take out all the cells, and then study the cells. So very, very early cancers. It's just started. It's just a few cells, and those cells are picked up. And that's how you go into early diagnosis. And this can be done very, very early. So predictive analytics are something that is very, very useful in healthcare. So you can have AI algorithms. You have analysis of patterns in data. So you have in fact, today, Modi has started, or whatever, the government has started healthcare cards. So you can put in all your medical records into a database. So we started with Aadhaar card, but then we are getting into all details of everybody. We are the only country in the world who have retinal images of everybody in the country. And now we are going to have the healthcare records in a huge database. So when you have a repository of all that, you can actually know. Now today you see a lot of people having fever. So what is happening in Bangalore? Dengue is starting. So immediately you make sure that mosquito menace is solved and then stop dengue from going. So you have you're predicting, if it has started in Tumkur, it's going to come to Bangalore in the next 1 week, and then you stop it from spreading, and then you take all the measures. So predictive medicine is something that we have to go in. We are looking into preventive medicine rather than detect. So in medicine, in healthcare, there are a lot of levels. The first and foremost level is preventing diseases. The second is early detection and treatment. The third is you treat when it is an established disease. And fourth is you have not even treated at that time, you rehabilitate the patient. Means somebody has developed a stroke, he's got paralysis, his hands and leg are paralyzed. Now you just rehabilitate him because you're already late. So we can move from level 4 to 3 to 1 by using artificial intelligence. So now that's all about early detection of ailments. Now let's go to improved decision making. So how do you decide what is happening? You decide by looking at health records. Somebody had, they have X-rays, they have ECGs, they have ultrasound scans, they have lab reports, they also tell you what is happening. So these are something called health records. And today we have made it EHRs, that is electronic health records, because everything is in electronic media. Now, what is more important is when the events have taken place. So the timeline is more important. What happened 6 years ago? What happened 2 years ago? What happened 6 months ago? And when we look at these timelines, we know and we are able to have a lot of important information to treat a patient. So these are in terms of text files and images. But then we can make it even more better when you get into AI. So you can have, you can look at how many times he applied for insurance claims and what ICD coding. So ICD coding is every disease has one number or a code. So look at the codes. When all the patient had, these were the times when he fell sick. But each time, what are all the data that you are getting? What were the medicines he had taken? What were the procedures that were done to him? What were the investigation reports when it was lab tests were done? And what did the clinical notes say? So a whole lot of data can be collected, and this can be analyzed. See, a doctor cannot sit and read all this, and it will take him 3 days to go through a record of one patient. But then using AI, we are able to do all that. Now, after knowing all that, imagine you have a very complicated patient. I don't know, none of you are doctors, I suppose. This is something that a doctor can understand. This is a very complicated disease and a rare disease, systemic lupus erythematosus. Supposing a teenager, somebody of your age or whatever young adult has come, having this disease, and that patient also, we find in urine test, protein is going off the body, and then when we do a scan, we find that the patient has a pancreas problem, infection in the pancreas, and then there are some antibodies that are seen in the body, in the blood test. Then now we want to know whether we can give an anticoagulant. This patient can develop blood clots in the leg because the patient is all the time sleeping for a long time. Now, should we give it or should we not? Now, there's no data to support it. We don't know what to do. So, what do? We take all the patients. This was the patients who have pancreatitis. This is the patients who had SLE. These are the patients who had antibodies. These are the patients. So we look at what this common data with common patients who had all the four, and then look at that and then try to say, in this patients, what was the type of risk? What was the type of, did people have clots? How many people had clots? It's very complex. And so sometimes it's very difficult to assess whether we need to, we are able to come to a conclusion of what needs to be done. Now, so what you do is you take these data that you already had in the created in the AI, you convert it into 3 timelines, and then all this data that you had, or the detailed data, you convert it into a matrix, and this layered matrix has much more detail. You analyze every small thing that the patient had, and then using that you create an algorithm, and this is done using AI. And when you have this, you know whether to treat this patient or how to treat this patient. Both these questions are answered. So why does this matter? This matters because doctors still don't have a knowledge about how to go about. They know that they know how to treat each one of these. A patient who has SLE, patient who has proteinuria, a patient who has pancreatitis. But when a patient comes with all these things, we don't, till now we don't have enough records, we don't have enough data. So even when you don't have data, when you don't have knowledge, information about something, using AI, we are able to reduce things and we are able to accurately treat patients. This is something phenomenal. So now let's come to treating patients. Now, adverse effect prediction. Now, how do you know medicine, whether there are so many medicines that are coming every day. So many, there are some patients who take some 12 or 15 different types of medicines. So one medicine can cause reaction, it may not go well with another medicine, or when you give these two medicines, something else will change, or when you are giving this medicine, you want to give another medicine, you need not give that at this particular dose, you need to reduce the dose and give. So all these decision making, definitely you can predict adverse reactions of medicines, you can look at the health records and data sources, what has happened to other patients, plus what happened to this own patient earlier. And this gives you the information to decide and prescribe the right medicines at the right dosage for these patients. And today we are going into personal medicine. I always believed that we're not the same. We're never the same. You have a big rose garden in Lal Bagh. You go and try to look at every flower. Every flower is different. God has created everything differently. So when you go into details, when you go into minor details, all of us are different. But then, if you have a headache or a fever, you take a Dolo 650. This is what everybody tells you to do. So how can one dose, one tablet, one dosage be okay for everybody? So, because we don't know what to do. So 90% of patients are, people are okay. It may not be okay for the next 10% of people, but then those guys have to suffer because we don't know. We don't have enough information what to do with the others. So that's what we're doing. But today we have so much more discoveries, so much more inventions, so many things are happening, and we have to grab all that and analyze that. So what is happening today? We're getting a lot of genetic information, genomics, all of you know about it. So using genomics, we are able to look at the RNA sequence, the DNA sequence, You analyze the lifestyle of a patient, whether he is walking enough, whatever he is eating, gene expressions. Look at X-rays, ultrasound, CT scans. You look at the phenotype of the patient and you go through all the health records of the patient. And looking at all this, you go through a whole process and then finally decide on the personalized medicine that the patient has to get. So don't take everybody the same. So how can you do that? When you are able to have enough knowledge, when you have enough information about an individual, you are able to treat him personally. And that is what is going to happen in the future. We have something called functional medicine. And this is all to do with this type of medicine. It's becoming very, very popular in US, and it's going to be the in thing in our country. So next, coming to expanded access to medical services. How can you, instead of treating one patient, treat 1,000 patients? So this is one guy who, I don't know, some of you were born at that time, some of you were not even born. There was a big photograph in Deccan Herald, front page. Father and mother kissing his cheeks on both sides. He got 15 gold medals during MBBS. Every subject, right from the first year MBBS to final year, he was a gold medalist of Bangalore University. So this is Anand Vinekar. Brilliant guy, brilliant guy. His wife was my student. I know him very closely for the last more than a decade. And he is an ophthalmologist today. Very intelligent. He cannot limit his intelligence to treating a few patients every day. So he's gone into technology, understanding things much more and saying what he can do to help the society. And he went into this retinopathy of prematurity. What does that mean? So you know what is prematurity? Yeah, before how many months? Yeah, somebody who's born before 9 months is called premature delivery or a premature baby. So some of my patients come and say, I'm a premature baby, I'm alive, I'm stronger than others. So this is, what are the problems? They have many problems. Some of the body systems are not fully developed. They are more at risk of catching infections because they don't have immunity. And amongst many things that are happening in them, they have something called retinopathy that can come in. And that retinopathy starts, and in over 6 months it develops, and in 2 years the baby is blind, and blind for life. And how can we prevent it? Can we prevent it? Yes, we can. We have a way of, if we can detect that, then we can prevent them from becoming blind. We fire lasers and stop the disease from increasing, retinopathy from increasing in the eye. But then who knows where? Some village somewhere in Bidar or Gulbarga, somebody is born. Would you want that person to become blind? Definitely not. Bangalore, maybe we can cover people, even if to cover everybody in Bangalore is not going to be possible. What about everybody else? So he came out with this idea of trying to go on mass screening. So he went to every place, trained. We have some people called ASHA workers. So they are in all the villages, they are in primary health care centers. So what did he train them? Not to see the eye, not to examine and diagnose. He gave them a camera. That camera was developed in India, somewhere in Kenya, because cameras are available for very, very expensive. They are 50 lakhs and things like that. So they brought the cost to a very low level, and that they could do by reinventing cameras. And then they taught them how to take photos in all these villages and then upload them into a server, to a website. And when that came in, doctors started analyzing these images. And then whoever they felt is having retinopathy, call them. Now it's become huge numbers. Doctors cannot manage screening so many images. So now he started using AI. So he started putting all these images. He developed an algorithm, and then he extracted all these things. He managed to change the images. He looked at optimization of technologies which he has published all over the world. He's been called to 200 countries to tell them how he did it. And then finally, he developed an AI method in which the images were seen. The vessel that was developing a retinopathy, the retinal vessel, was detected, and this would tell people which are the babies which will go blind. And so immediately they could call these babies to major eye hospitals and then prevent them from being blind. And his algorithms are very, very accurate, better than anything that anywhere in the world has happened. So next we go to associated care. So today we are seeing a lot of people in Bangalore living long enough. And more important, we are having people who are isolated. You go to Jayanagar here, every alternate house, the children are abroad. They are either in US, UK, Australia, Germany, Canada. So they are all alone, and they need a lot of home care. They need a lot of semi-trained, untrained people to take care of them. So many, as they grow old, they need rehab. So this is a very major issue. So what does this mean? Care meaning if they are falling sick, somebody has to find out. They are not having resources to go to the hospital. Not everybody can reach out all the time. Secondly, it can happen somewhere in the middle of the night, something may be going wrong. So somebody is having a diabetes, suddenly sugars go low. If you don't detect it at that time, he is going to go into coma and die. That can happen in the middle of the night. So you have wearable devices, you have detections, you have ways of telling the caretaker what to do. And all this happens using AI. So that's a great thing, a huge social impact that AI can do. Next, let us go to how can you make a patient care experience superior. So we have computer aided diagnosis. We look at medical images. I told you millions and billions of medical images. Doctors cannot see everything. There's a limit to what his eyes can do, what his brain can do, how much fatigue he can take, how much effort he can put. But computers don't get tired as long as KEB is kind enough to give electricity. And we can go on at a rapid pace, screen a lot of images. It can be a patient's face, where you just looking at a patient, we are able to diagnose a few diseases. Looking at the tongue, I know. Looking at the skin, some rashes, something that is coming up, I can say what disease a patient has inside his body. Looking at images, looking at pathology slides. So all these are ways of diagnosing and then treating. Now, wearable devices. All of you know, either you may have a watch, you may have a phone, you may have a ring. There are glasses today, smart glasses, which keeps looking at your retina all the time. Picks up a lot of signs that are happening. You have wearable devices. In fact, one of the Indians about 2 decades ago, he was got one of the best innovations, the 10 innovations in the world. I think it was in 2000 AD. So what he did was he was a fabric designer. So he got this lycra, which you guys have these tight pants today. So they stick to your body. So taking those things, he made some sensors. He put sensors, all types of sensors in those lycra, and made pregnant women wear it. So the baby's movements are monitored. The baby's heart rate is monitored. There are so many people who are pregnant and then fifth month, sixth month, seventh month, suddenly the baby dies. That's because something went wrong and it was not detected at the time it had to be detected. Now people wearing this lycra t-shirts or whatever you call it, they could save, they showed that they could detect something going wrong with the baby and they could save the baby. So like that we have a whole lot of devices which is not only the present but the future of healthcare. So you can detect what is happening with a person and take action. Now coming to end of care. So what do you mean by end of care? Can somebody answer? What do you have in mind? What do you think is end of care? Say something, even if you're wrong, you're not facing an exam. Death. No. Death is not end of care. The doctor is caring. When does he end? He ends when the patient dies, right? That's
Does it mean insofar as cases of cancer is concerned?
cases of cancer, yeah. So where somebody has a cancer, it's totally spread. You know, you can do nothing. You don't have technology or science of material to make him cure him. You don't want him to live longer because he is only suffering. Every day he has pain. So you say end of care. I'll stop here. There are people in ICU who are on ventilator for a very long time, and then at one time you say, no, he's not improving. We are spending 25,000 every day. The family has sold all its properties. Now there's nothing left. But even if it is nothing left, you still want to do something if you know if there are hopes. But then this patient does not have any hope. So why do you continue anything? So you put off the ventilator. That is end of care. So,
Doctor, I am sure you are not referring to euthanasia.
No. It's not euthanasia. You stop supporting. You stop giving medicines. And you allow the patient to his destiny. Now, we imagine, I don't know if you read about Steve Jobs. There's also a book where a lot of people have written what they would have wanted to know if what they wanted to do in life, or what they wanted to do if they knew that they are going to die a little earlier. There was so much they wanted to do. Now that can be done by artificial intelligence. So they've looked at a lot of people, they've analyzed, they said, what is the time you should tell a patient is going to die? How early would you want to say? As early as you can make out. And now there's enough science to predict death 1 year before the patient dies. And that they're able to do it. And once they do that, the AI is able to find out in the next 1 year this patient is going to die. That information is given to the doctor. And the doctor knows how to put it to the patient, how to talk to them, how to communicate. Because you can't tell somebody you're going to die next year. So, and then that has been used in about 15% of patients. They're not telling everybody, but then they have started telling, and they've seen that it has made a big difference for them and for their families. So that is another major issue in artificial intelligence. Now, this is my personal problems. I'm a surgeon. I operate on hernias. Anybody knows about hernia? Heard about hernia? Yeah, okay, that's enough. So hernia is a swelling that comes anywhere in the abdomen. The muscles give way and the intestines pop out, and that's called hernia. So when there's a hernia, there are a whole lot of things that we do, and how we do, what we do is all, there's a huge variations. Now for example, I'll go in briefly. You can stitch up the muscles, you can put a mesh inside, you can do something called component separation, and in the mesh you have 10 different types of meshes. synthetic, composite, biological, and then how to fix the mesh, whether you want to fix it with glue, whether you want to stitch it up, whether you want to put staples, tacks, and where you want to put the mesh, whether below the skin, between the muscles, inside, within the muscles. What is the technique? We have various different types of techniques of operating, and then before doing that, we have many, if it is a very large hernia, to put the intestines inside and bring the whole muscles together, we have different technologies that help us do that without the patient feeling breathless. So all these things, and then we have images, CT images. Now if you can see, there is no muscle between this, there is a huge gap in the muscles, and a lot of intestines are popping out. So we need to see how strong these muscles are. Can the muscles come together? Can if it doesn't come together, you cut it and then pull this way. There are a whole lot of things that we do. So all that analysis is done on CT scans, and then you have to understand that these are very complex problems. There is no standard way of doing things to them. And if you develop an algorithm to decide on what to do, how to do, what all materials you should use, and how they should be treated, all that is definitely going to be the best thing that we can do in future. So to do all this, we have to identify the parameters. We have something called Indian Hernia Collaborative. So every doctor in the country has an option of having a Google form and then filling up all the data of all the patients he is operating on hernia. And then after that, did anybody have problems? What all he had done? Which one failed? Which did not fail? And how was it painful for the patient? Everything goes into that. So if we have all this data and we standardize the variables and give all this data to engineers, and they develop an algorithm or a model, and this is an interface between surgeon's knowledge and engineer's expertise. So we develop a model which can be used to treat every patient with hernia. You just put all the parameters and it tells you what all to do, how to do, and when to do. So once you have that, you have to validate. You start using it, surgeons start using it and say, hey, this is only 95% accurate. You have to get 5% more. So again you change the algorithms and then make it 100% accurate. And then tomorrow some new technology came. So you have to keep continuing this algorithm. This is how surgeons and doctors work together. Drug discovery and development is another major thing that has come. I will give you one example. If you have to do a clinical trial and develop a new medicine, you have to go through these things. You have to decide where you have to work, how you recruit patients, how many people you have to recruit, how you monitor them, and then how you analyze them. All this is a huge process which normally takes $1.2 billion. It takes more than 5 years to develop that. And at the end of 5 years, after spending $1.5 billion, only 1 in 5 is a successful medicine. So 4 of 5 has lost. So this is a huge thing that's happening. But then we had a major challenge during COVID when the first ever AI trial was done. So in MIT, Massachusetts Institute of Technology, they developed this vaccine called Janssen COVID-19 vaccine. And for that, they knew that this is the amount of time. It takes 4 to 6 months to choose the location, 1 to 2 years to recruit patients and work on them. 3 years monitoring is required, and to analyze data, it takes about 6 months. But then do you have that time? So many people are dying like flies. 10,000 people dying every day. So they said we have to reduce the time that is taken for clinical trial, and people with disease and trials should increase. So they said in 4 months we should finish everything. What they were taking 5 years, they wanted to do in 4 months. So they created this AI tool called Delphi, and then they asked Delphi, we are going to start this trial 4 months from today. Where will be the maximum COVID disease? And it told them where the disease will be. Actually, looking at the amount of disease that was there that day, nobody could even believe it will be like this. But then they asked again and again, and it said the same answer. So they said, okay, fine. And then there, in those countries where to do the trial, it showed where exactly will be the maximum disease, and they chose that. And then they did the trial, they invented the vaccine, and finally, in 8 weeks, they could finish up the trial. So they reduced the timeline by 33%, and they could recruit less patients for their trials. So 25% less patients, they could finish the trials. So not only that, they could, because they went to different countries, they got a whole lot of different diverse vaccine viruses were fought with, and a better vaccine was developed. So now today, using AI, we know that we can speed up the trials, we can make it accessible to people, and then we can monitor remotely. You can recruit people from different villages, different towns, and you can monitor them, and you can develop things very fast. In healthcare, I don't want to go into administration more, but there is a whole lot of areas where administration of a hospital can be helped using AI. And finally, when we do all that, doctors will have more time to spend with patients rather than going for licenses, going for quality control, going for recruiting people and all that. So benefits of AI in medicine is improved accuracy, enhanced efficiency, faster diagnosis. There is reduction in cost and access to healthcare in remote areas. Every villager in India can have good healthcare using AI. But there are a lot of challenges. These are some things that I would like to discuss with people who are into the engineers who are developing AI for healthcare. But I would just pass on as a mention to you, data privacy and security is a major issue, because everybody's data is there. It can leak out. Maintaining regulatory compliance is an issue. There are a lot of ethical concerns, and there is bias and in different algorithms. Now, when you have a problem, you go to a doctor. If you're not fully convinced, you go for a second opinion to somebody. Like that, in AI, you have different algorithms. If you are not satisfied with one algorithm, you can use another algorithm and see whether the treatment should be the same. So like that, there are a lot of bias. So those are also challenges that have to be looked at. Fostering trust between AI systems and healthcare professionals. I should believe in AI before it is delivered to you. And healthcare workforce reinforcements. It is not just me, but the nurses and the ayas and everybody should believe in it, and they should start using. In fact, there were apps that were used to treat psychiatric patients, and they started psychiatric patients put in records in telemedicine. The AI only started giving them what medicines they have to take. But then, but then they were told after some time that it is AI, it's not a doctor on the other side. And then when they compared the treatment being given by doctors and by AI, AI was giving exactly the same quality of treatment, but then the response of the patient was not as good with AI. It was good with the patients being treated by doctors. And that's because there's something called faith and trust. And there is a whole lot of more things. People were terrible at knowing when they were interacting with AI generated response. It wasn't all that great. It was something new to them. There's something called pragmatics and semantics. So semantics is propositional context expressed in utterance or act of communication. So it is like, what is India? India is a country. It's like that. So the AI will specifically go and answer questions. But what happens? What is pragmatism? They are conveyed by a speaker in addition to what he is literally stated. Would you like to live long? Well, I am trying to suggest to you, saying, live long by using this medicine or whatever. So like that, you can threaten somebody without actually saying, I am going to kill you. You have to follow this. So the way we tell, the way we put things, so all that can happen through a doctor, it cannot happen through AI. So the psychological behavior, and the utterance and how a person listens, all that matters. So indirect speech acts and conversational implications. When I am giving a letter of recommendation, there are a whole lot of things. If AI has to write a letter of recommendation, it says this fellow attended the class so many days, this was the marks he took, this is what. When I write, I say this fellow has got a lot of potential, I've seen him. So all those things, metaphors, flouting, all that happens. So what about ethical considerations? Patient privacy, data security, informed consent, bias and fairness, we've already spoken to that. Transparency and explainability, how we can do that. Who is going to be accountable? I treat you and then I say software said that, so I gave you. You sue the software, not me. So clinical validation, when you have something, you've developed an algorithm, you have to clinically validate it. And then there is always a continuing monitoring and updating that happens in any field of science. So now final question, will doctors be replaced? Tomorrow you go, you're flying to America, you've gone to the airport and then suddenly you start coughing. And then do you have a kiosk there, say I've got cough, I feel feverish, I have a little heaviness in the head, what do I do? And then the thing comes out and then would you start using it? Or would you say you just call up your family doctor and say, doc, this is what I'm having, what do you think I should do? Well, your doctor knows everything about you right from the time you were born, and then he knows what medicines have been working on you, how delicate you are, what you should be doing, what is your emotional status when you're traveling, everything he knows. So definitely you have a better answer through doctor. So smart medical technologies exist to support a physician and improve patient care, but it cannot replace doctors. There is something called empathy, there is something called compassion. And these are things that emotions are not there in machines. And definitely human beings will be superior to machines all the time. Thank you for a patient hearing.